So guys, as a little appetizer for our next life surgery course, we quickly want to go over something which I think is probably the most powerful and underestimated component in liposhaping, and especially waist shaping, something that we call BIC-Lipo. And that is a very frequent question that we're confronted with both from patients as well as participants. What does that actually mean, BIC-Lipo? Well, BIC-Lipo stands for below iliac crest. Iliac crest is a part of your pubic bone, which is a little bit like a concave cavity, as you see in the picture here. And this bone has a crest, which you can feel basically circumferentially like a bony prominence. And in every patient, this crest is a bit higher or lower, it's wider or it's narrower. And whilst often patients, and sometimes even surgeons, seem to think we're all just a ball of fat and we can shape ourselves to our liking, of course this bone is an important limit, and the zone below that bone is critical for the outcome of your body shaping surgery, and there you can win a lot and lose a lot. Because if you leave too much fat, your waist will look straight. If you remove too much, too low, you will have a hollowing out, or let's say prominent bony edge. And you see here, for example, a patient which has slightly higher pelvis, where you have to be careful to kind of taper it down. And this is a patient with a lower pelvis, where you can be a little bit more aggressive in the space between the 12th rib at the iliac crest. But believe it or not, it doesn't only depend on what you do, it also depends on the patient's anatomy. So I think the first step when you plan your procedure and when you discuss that with your patients is actually understand that everybody's got a different bony anatomy, which sometimes patients actually refuse to accept, but that's the way it is, and we have to plan around this. And I've selected an example here to point out to you where, and this is actually, it is my case, you know, I'm not pointing at other people here, where I critically say, look, I did remove a little bit too much. And then you see here that this is actually the iliac crest. It's a patient with a very, very, very high pelvic bone. The iliac crest here slightly shadows through. I think it was not a big issue, yeah, but I think it's an excellent example to demonstrate where you say, look, here you come to the limit. And you will probably come for a patient say, hey, didn't remove enough fat here, but what actually they feel is bone. And if you suck out more underneath, you can run into an aesthetic disaster. So you have to be very, very careful and aware of that. And you see here a case which I probably think will consider a point landing. You see here the edge of the pelvic bone, the kind of bowl-shaped bone, where you just get the right amount. I think if you just suck out a little bit more, the bone will start to bulge out. And to demonstrate this, we've kind of shadowed the iliac crest into that. And I think that nicely serves to demonstrate what is the challenge here, just to remove exactly the right amount below the bone. And if you remove too much there, then you get a bulging off the pelvic bone. So this is why below iliac crest lipo is worth taking the effort. It's a bit challenging. You have to be very exact. I think one of the pearls that we actually want to share with you in our life surgery course for doing this is doing it from different angles, and especially from coming from the inferior gluteal crease is a very, very effective thing to get a nice result in that area. So I think this is really ideal, you know, for our life surgery events to learn that, you know, when you can see and feel. Yeah, this is sometimes a little bit abstract to understand, and what we'll really try to show you some nice tricks, you know, how to make sure that you don't run into over resection and not finally skeletonize the iliac crest. So I hope that's a little appetizer. I think it's one of these little things that often make a difference between a reasonable and a great result. So myself and my partner in crime here, Debajo, we will be delighted to have you for our surgery course and take you to theatre and show you how to do this, because I think it's a very well invested effort. Hopefully we see you in Marbella.